The government shutdown just entered its 19th hour with no end in sight. On Capitol Hill, Republicans and Democrats are playing the blame game. Each party insists the other side is at fault for the government running out of money. Roughly 750,000 workers are expected to be furloughed, and the Trump administration is threatening mass firings. Thousands of Minnesotans will not get a paycheck until this is all over.
As WCCO's Caroline Cummings reports, advocates warn that thousands more will see health care costs soar if Congress doesn't renew the tax credits at the center of this debate.
For the first time in almost 7 years, federal government funding lapsed, leading to a shutdown. Social Security, Medicaid, and Medicare benefits aren't impacted, but hundreds of thousands of Americans and roughly 18,000 federal workers in Minnesota, plus even more in the military, are in limbo.
Well, it ends when the Senate Democrats pick this bill up, passed by the House of Representatives, and vote for it.
Due to the makeup of the Senate, that chamber is at a stalemate because Democrats want expiring health insurance tax credits for the Affordable Care Act to be renewed in exchange for their votes.
When it comes to people's premiums, this is not a December problem. It's not a January problem. It's a now problem.
On Wednesday, advocates and state officials warned of the soaring cost of health care if those ACA tax credits at the center of this dispute aren't extended.
A lot of farmers are going to be faced with a choice. Buying a health care insurance policy versus making their loan payment to keep themselves out of foreclosure, or in some cases, putting food on the table.
Grace Arnold, commissioner of the Minnesota Department of Commerce, says 90,000 Minnesotans would see a hike without the additional subsidies to bring costs down. And people covered through the individual insurance market are expected to see an average rate increase of more than 20%. The middle class, she says, will be hit the hardest.
We had anticipated an increase, but what we're seeing is a real gut punch. This goes beyond the numbers. These hikes push real people to make impossible choices.
Caroline Cummings, WCCO News.
The tax credits at issue were first approved in 2021 and expire at the end of the year. Open enrollment for 2026 health coverage begins next month.